Well, good morning, everyone, and welcome to this webinar this morning. If there's any technical hitches, please do bear with us. We'll try and resolve those as quickly as possible. Those of you who are joining by your PCs, laptops, tablets, or mobile phones should now be able to see this introductory slide. My name is Derek Sinclair. I'm the Senior Parent Advisor on Contact's Family Finance team. We provide detailed advice and information on all aspects of claiming benefits and tax credits for families with a disabled child. I'm going to hand over control of this session just for a few minutes to one of my colleagues, Tracy Francis, who is from ARC Scotland, and they've been involved in organising this series of workshops. Tracy, would you like to say a little bit to the participants this morning, please?
Yes, I'd just like to say hello. Thank you for joining us this morning. I know some of you have been along to all the webinars that we've done in this series, but it's great whether you've seen them before or whether you haven't. It's great to have you with us today. I work for the Scottish Transitions Forum, and I'm responsible for the Parent and Carer Network. And the idea of coming up with this series of webinars was because we felt that parents and carers need information around key areas of planning for your young person's leaving school, transition to adulthood, going forward. So this webinar is part of that series that we've been running through July and August. And it's just to let you know, if you've missed any of those sessions, all the recordings are available on our website, www.scottishtransitionsforum.org.uk. But I'm so pleased that we've been able to partner with Contact this morning to put on this event, because their family finances team I know is second to none. I've actually used them in my own personal circumstances. I've recommended them to lots of people, and I know that they really know their stuff. So when you're a parent, when you're thinking about money, you really need to get good quality information from people who are in the know, and we're in really good hands this morning. So Derek, I'm going to hand back to you and let you take it from here. Thanks very much.
Thanks for that, Tracy. Okay, so today's session is really an overview of the main benefits for families who have a disabled child aged between sort of 16 and around about 19 or 20. So hopefully by the end of today's session, you'll understand the process that's involved in moving from DLA to personal independence payment and when that's likely to happen. And also you should have an understanding of the sort of situations where you'll be able to continue to receive child benefit and other payments, perhaps like tax credits, for your son or daughter as a dependent child. And finally, at the end of the session, we'll also look at the rules that can allow you to claim benefit for your son or daughter as a young adult in their own right. And in today's sort of terms, that really means making a claim for universal credit as a young disabled person. So if I'm not able to answer all the questions on the day, what we'll do is we'll post common themes and questions on a web story that we'll put on our website and on our social media channels. That will probably happen in the next sort of 2 or 3 days, or at the beginning of next week at the latest. Now, if you are looking for advice more quickly than that, of course, you can access advice via our website. We do have specific benefit pages, including one on benefits at 16. Or you can actually phone our free helpline, the Contact helpline, and you can access individual advice on any sort of benefits issue, including benefits issues for children of the ages of 16 to 19. At the end of this webinar, a short questionnaire will launch. It would be really useful if you could take the time to complete that, as it helps us to plan future webinars and also other sorts of training events. So I'm going to start today's session really by looking at personal independence payment, which is the benefit that replaces DLA for adults. Under the existing rules, children on DLA are normally asked to claim PIP shortly after their 16th birthday. So what normally happens is a week or two after your child turns 16, they will be contacted by the DWP and invited to make a claim for PIP. And if they don't do that when they're invited, then I'm afraid that their DLA payments will be suspended and eventually will be stopped altogether. As long as your child does comply and starts the process of claiming PIP, then their DLA award will be temporarily extended until a decision is made on the PIP claim. Now, at the moment, there are only 2 exceptions to the rule that requires a child to claim DLA after their 16th birthday, and that is if a child is terminally ill and qualifies for DLA under the special rules, then currently that child will be exempt from having to claim PIP altogether. The other group who are currently exempt are children who are hospital inpatients. So if your child is a hospital inpatient when they turn 16, they're not going to be asked to claim PIP until they've been discharged home. But the really exciting news really is that these rules are going to be changing, and that for children in Scotland, DLA is going to be extended to the age of 18, and that's due to happen from the start of September. So what are the new rules in Scotland? So basically, from the 1st of September, if a young person lives in Scotland and they already get DLA and they turn 16 on or after the 1st of September, they're not going to be invited to claim PIP at the age of 16. Instead, their DLA award will be automatically extended to they turn 18, and they won't be invited to claim PIP until after their 18th birthday. Now, interestingly, if your son or daughter is 16 after the 1st of September, they still have the option of claiming PIP if they want to. So if they're desperate to try and claim PIP, they can still do so. It just won't happen automatically. They won't receive an invitation to claim PIP, but they still can themselves opt to contact the DWP and make an application. However, we have to say that that's not necessarily a good idea in a lot of cases. The reality is that lots of disabled people end up worse off on PIP than on DLA. And if your son or daughter chooses to claim PIP and they don't like the outcome, they can't reverse that and go back onto DLA. So really, our advice is we wouldn't suggest that any young person opt to claim PIP themselves unless they first had very detailed advice from a benefits advisor. Now, the new rules that are coming in only apply to young people who turn 16 on or after the 1st of September. It doesn't help anyone who turns 16 before that date. So if your son or daughter is turning 16 tomorrow, they're still going to fall under the old rules, and they are going to be asked to claim PIP at some point after they turn 16. Now, normally people are asked to claim just a week or two after their 16th birthday. During the coronavirus outbreak, something different has been happening. The DWP have been contacting young people turning 16 to say, right, we're going to extend your DLA for a period, but we will be back in touch with you in the near future to get you to make a claim. And at the moment, they're not really doing PIP assessments because of the coronavirus, but that process is starting to open up again. Now, if your son or daughter is turning 16 after the 1st of September, but they don't already get DLA, the new rules are not going to help them either. Okay, so it's too late to make an initial claim for DLA after you turn 16. You'll have to claim PIP instead. And the new rules are really about allowing existing DLA claimants to continue to get DLA until they're 18. It's not about letting new claimants apply at the age of 16 or 17. Okay, so hopefully the new rules make sense to everyone. If you've got any questions, please let me know. Regardless of whether your child claims PIP at the age of 16 under the current rules or is able to wait and claim when they're 18 under the new rules, the process is essentially the same, and it's got three main stages. So the first stage is that you'll be written to by the DWP. That letter will either go to your child, or if you're acting on their behalf, it will go to you. And you'll be invited to claim PIP by phoning a PIP claim line, and you'll be given a specific date that you have to do that by. Now, a lot of parents get quite worried about this telephone call. They know that a basic form is going to be completed over the telephone, and they think, they're going to be asked detailed questions about their child's care, supervision needs, and they're a bit worried that they might not get that information over very well over the telephone. But in actual fact, you don't need to worry about this first stage. The form that's filled in by the DWP over the telephone is not a detailed form, doesn't ask you for lots of questions about what your child's care and supervision and mobility needs are. Instead, it's a really basic form that just asks questions about your child's identity. It asks about who the doctors are that are involved with your child's care, if there are other professionals involved, what the school or college is that they attend, and also just checks that there's not certain barriers to them claiming, like there's no immigration restrictions. Once the DWP are confident that your child will potentially be entitled to PIP, then the second stage is that they'll send out a written questionnaire for your son or daughter to complete and return. This is called the PIP2 questionnaire, or how your condition affects you. And really this is the equivalent to the DLA form. This is what's really important to take your time in completing. So this is a self-assessment form which asks you to explain in detail what sort of difficulties you have in terms of needing assistance, needing supervision, needing prompting to do a number of tasks. So that's a really important part of the process. At that stage, as well as returning the questionnaire, you can also send additional information in the form of supported evidence. Now, for most people, there's usually a third stage, which is the involvement of a consultation with a health professional. So this is not your own doctor, it's not a consultant that knows your child. This is a health professional employed by a private company called Independent Assessment Services. Now, normally, these assessments take place face-to-face at a medical centre. During the coronavirus, there are no face-to-face assessments currently happening. So what will probably happen in your child's case, if they're assessed at some point in the near future, is either there won't be a stage 3, either the decision will just be based on the written evidence, or if there is a consultation, it will be done over the telephone. Your chances of getting a decision just based on the paperwork is much better if you can provide detailed supportive evidence at stage 2 alongside the PIP2 questionnaire. Now, for people who are used to DLA, PIP looks very similar. Okay, it looks and feels very familiar to anyone who's used to dealing with disability living allowance. So it's got two types of payment. There's a mobility component. There's also a daily living component, which is the equivalent to the care component, and it looks at the need for care and supervision. It's not means tested. It can be paid both to disabled workers and to people who are out of work. There's special rules for the terminally ill, and there's special rules for people who are in residential care. In addition, if you get PIP, it can also act as a gateway to other types of help, things like mobility vehicles, additional tax credit payments, eligibility for carers allowance. So all of these things are really similar to what currently happens under DLA. If we look at more sort of closely, though, we'll see that a lot of those things that seem very familiar are quite superficial. There's some real major differences between PIP and DLA. So firstly, while the care component of DLA has 3 rates, there's actually only 2 rates of the daily living component under PIP. There's an enhanced rate, which is equivalent to the high rate DLA care, and it's paid at the same rate. There's a standard rate, which is equivalent to the middle rate of DLA care and is paid at the same rate, but there is no equivalent to the low rate care. So I suppose that if your child is on the low rate care, there is a heightened risk perhaps that they might be worse off moving on to PIP. Under DLA, certain groups of claimants who have conditions like being registered blind or deaf blind or double amputees automatically qualify for certain rates of DLA, but all of those automatic entitlements have been scrapped under PIP. Everyone has to go through the full assessment. Under DLA, to get the high rate care, it depends partly not only on what care and supervision your child needs, but when it happens. You have to show that your child needs both day and night care. PIP's not really interested in when the care or supervisions needed. It's only interested in what needs you have and how severe they are. We've already seen that there's a slightly different assessment process, and that can involve a consultation with a health professional. But more fundamentally, PIP and DLA are not necessarily measuring the same things. There's a different criteria for PIP, and there's a different way of assessing whether your child qualifies for the benefit, and it uses a points-based system, which is something completely unknown under DLA. Now, when you look at Disability Living Allowance, it's a fairly holistic assessment. What they do is they compare your child with the average child of the same age, and if your child has additional care of any type or needs supervision of any type and for any reason linked to their condition, it's going to be taken into account. But personal independence payment is a much more targeted benefit. The assessment is targeted at particular areas. And if we look at the daily living component, which is the equivalent to the care component of DLA, then really what they're only looking at is 10 specific areas. These are the areas that they see as being the most important ones for independent living. So it includes things like cooking, it includes washing and bathing, dressing and undressing, mixing with other people, making budgeting decisions. These are the things that they're going to look at. Your child might have needs in other areas. For example, you might have a child who needs physical assistance to get in and out of bed. But actually, it doesn't matter how severe that problem is, it's not going to be taken into account because it's not one of the activities that the PIP assessment considers. So what the PIP assessment does is it looks at the need for physical help, for prompting, for supervision in each of these areas to see whether you need help to undertake these tasks reliably. So the test is not whether your son or daughter can undertake these tasks as a one-off, it's whether they can do it reliably, which means as many times as required. It means to do it safely. It means to do it to an acceptable standard and also to do it within a reasonable amount of time. The more help that you need to undertake a task, then the higher the score is that you get. So if we look at the first of these descriptors, which is preparing food, you can see there's a number of different scores that someone could receive. So if they can prepare and cook a simple meal for themselves without anyone helping them or without any aids or appliances, then they're going to score no points. It'll be 0 points. If they need to use an aid or appliance to cook, then it's 2 points. If they can cook, but only by using a microwave rather than a conventional cooker, they would get 2 points. If they need prompting to cook, they can get 2 points. If, however, they need supervision to safely cook or physical assistance to cook, then they would score 4 points. And even if they can't cook a simple meal, even with prompting, supervision, or assistance, then they would score 8 points. So if someone actually meets more than one of these descriptors, so let's just say your son or daughter needs both prompting and assistance, they would score the higher of the two descriptors that applies. So in this case, they would get 4 points rather than 2. So the DWP will go through each of the 10 daily living activities. They will give your son or daughter a score for each one, and that could vary from 0 up to 8 points. They then add together the total number of points. If your child scores between 0 and 7 points, they do not qualify for the daily living component. If they score between 8 and 11 points, they would get the standard rate, or if they score 12 points or above, then they'll qualify for the enhanced rate. Now, there's also a mobility component, and the mobility component only has 2 activities. So there's an activity which measures your ability to move around, which is just to get up and to walk a distance. Now, rather controversially, to qualify for the enhanced rate of mobility, the equivalent to the high rate, purely on the grounds of moving around, you have to show that you can't walk more than 20 meters. the equivalent test under DLA is that your child can't walk 50 meters without severe discomfort. So you do have a situation where some young people who can walk perhaps more than 20 meters but less than 50 meters might find that they go from the higher rate DLA mobility to the standard rate of PIP mobility. There is, however, another PIP mobility activity, and that's that of planning and following a journey. So this is about looking at someone's ability to sit down, work out how they're going to get from A to B, and then to reliably follow the route of that journey without help or assistance. So if someone is unable to do that, whether it's because of learning difficulties or a sensory impairment or autism, or perhaps because of mental health issues like panic attacks out of doors, they may well pick up points on this activity as well, or instead of moving around. Now, interestingly, some children with learning difficulties can find it easier to qualify for the enhanced or higher rate of mobility under PIP than they do under DLA. Because if you can show that your child's unable to plan and follow even familiar journeys without assistance, they should score 12 points and qualify for the enhanced rate. Whereas under DLA mobility rules, if a child's got a severe mental impairment, they not only need to show that they need help out of doors, but they need to show they've got disruptive and extreme behaviour. They need to show that they've got nighttime care needs. So arguably, for some children, this is a much easier way of getting the higher rate. And there are certainly some children that are winners, particularly around the mobility component when they move from DLA to mobility, to PIP. Now, the crucial issue here is before you even sit down and consider completing a child's PIP assessment form, the questionnaire that's sent out, you really need to make sure that you're familiar with the scoring system. So, you know, it's in your interest to be familiar with it, because what you're actually doing when you're filling in the form is you're self-rating your child, you're scoring your child. You're not necessarily aware of that when you fill the form in, because it doesn't say anything on the form about how many points you might get, but all the answers you give to the questions on the form, they all correspond to a particular score under the system. So you've really got to make sure that you're familiar with that before you fill it in. Now, you can access the full scoring system in different ways. You can download our free guide to personal independence payment, which is available from the Contact website. It has the full scoring system set out in the middle of the publication. Other guides are available. Many other charities produce PIP guides, and some of them will set out the scoring system as well. There's also a really useful website called pipinfo.net. And this it sets out the scoring system in a lot of detail. It tries to explain in plain English what the tests are, and it also has links to useful case law where judges or tribunals have said this is how this particular test should be interpreted. I also need to say a little bit about appointees. So regardless of whether your son or daughter claims at age 16, or whether under the new rules they continue to get DLA until they're 18, there is one issue that definitely needs to be resolved before they turn 16, and that is, who are the benefit payments going to be made to? Who is the DLA post 16 going to be paid to, or who is the PIP going to be paid to? And the good news is there is a process for deciding that very question. So the first thing to understand is that the Social Security legislation, the actual law, it presumes that a 16-year-old should be able to manage their own benefits. So there's a presumption that that is what should happen. But it also recognizes that there'll be circumstances where a young person might lack the capacity to manage their own benefits, lacks the capacity to understand their benefits, lacks the capacity to understand money, and lacks the capacity to understand what their responsibilities would be as a benefit claimant. And if that happens, what basically the arrangements are is that somebody else, usually their parent, can be made their appointee. This means you have the legal power to claim benefits on their behalf and to manage any benefit payments. Now, I want to be clear that you can only be granted an appointeeship if your son or daughter lacks mental capacity, not because it's more convenient for everyone. You can't be granted an appointee because you think your child lacks the maturity to make sensible decisions about how they spend the money, nor can you be granted an appointeeship if your son or daughter doesn't want the responsibility. There has to be some evidence that they lack capacity, and that's almost always mental capacity, although I suppose in extreme cases, it could be where a child lacked the physical capacity to do that. Now, normally the process for deciding whether an appointeeship is needed is that, first of all, they write to you several months in advance of your child turning 16 and ask you whether you think your child has capacity or not. If you indicate that you don't think they have, they will then try and conduct an assessment to decide whether they agree with that. Now, normally that's done at your home. Someone from the job centre would come out and certainly would interview you and possibly try and meet with your child. During the coronavirus outbreak, there are no face-to-face home visits happening, so those assessments, I'm assuming, are taking place over the telephone. Once granted the power of appointee, it applies to other benefits that you want to claim for your child. So it's really important, though, that you keep a copy of the letter you get confirming that you're an appointee, because we've had parents who've had difficulties trying to claim universal credit for their son or daughter and having to prove that they're an appointee. And it's much easier as a process if you've got that letter from either the DLA unit or the PIP unit confirming that you're the appointee for that benefit. The process should be much smoother. Being an appointee doesn't confer any wider powers to manage your son or daughter's affairs. If your son or daughter has other assets, if they've inherited money, for example, you don't have a power to manage those other assets simply because you're their appointee for benefits purposes. You'd need legal advice about becoming their financial guardian. That's all I intended to say about personal independence payment at this point. I'm just going to have a look and see what questions we've received thus far. If you just bear with me a second. Well, we did have one written question actually that someone had sent in advance of the session, and they'd been asking, it's Claire who'd asked, she's got a child who's already 18 and she hadn't actually applied for an appointeeship at the point their child had turned 16. And she was asking whether it was too late to now be their appointee. Well, it's an interesting question. I mean, I think it's not impossible to become a child's appointee at 18 if you can show that your child has been struggling and lacks the capacity to manage their benefits, although the assumption was that they could manage. If you can show that that's not worked and that they've really been struggling to do so, or if you could show that the child's condition perhaps has deteriorated or their abilities have been compromised in some way, then it might be possible. But I suppose you will be up against a slightly uphill struggle there, because if your child's been receiving benefits since the age of 16 and it appears to have been working quite smoothly, the DWP might take a bit of convincing that they lack capacity, but certainly it's not impossible. Okay, so now we're going to look at other benefits. We've considered the move from DLA to PIP, but what about other benefits that someone might be able to claim for a son or daughter who's aged between 16 and 19? Well, really, there's generally a choice of one of two options. If your child remains in full-time non-advanced education, then it means potentially that you as their parent can continue to claim benefits for them as a dependent. So you can claim benefits for them as part of your family still. So you can get benefits like child benefit or possibly child tax credit, or possibly if you're a family who are on universal credit, you can continue to get child payments for them as a dependent. The alternative is that the young person might possibly be able to claim benefit in their own right as a young disabled person. These days, what that means almost in all cases is that they would make a claim for universal credit in their own right. But there are particular barriers to that happening if your son or daughter is in education. And one of the things we also need to make clear is that these are two options. What you definitely can't do is both of these things at the same time. Because if your child is awarded universal credit in their own right, it automatically brings any child benefit or other payments for them as a dependent to an end immediately. So what's the sort of circumstances where you might be able to continue claiming benefits for your son or daughter as a dependent? Well, the first thing to say is no matter whether your son or daughter stays in education or not, they're automatically treated as a child at least until the September after their 16th birthday. So during that period, until they've reached the September after their 16th birthday, you definitely have the option of continuing to claim child benefit and other payments for them as a dependent child. Once they've reached the September after their 16th birthday, it really then depends on what they're going to be doing. Because in order to continue claiming for them as a dependent, they have to be staying on in what's classed as full-time non-advanced education. Now we'll look at what that actually means in a minute or two, but before we do that, I just want to say a quick word about where a child is temporarily unable to attend their course. Because we get lots of calls on our helpline from parents where they've got a son or daughter who's 16, 17, 18, they've perhaps had a deterioration in their condition, or there's been problems where their course has broken down and their child is temporarily not attending a course. And what often happens in those cases is HMRC just assume that they've left education and stop the child benefit, stop the tax credits, stop the other benefit payments. But actually, child benefit and child tax credit, they have rules that say if your child's in a temporary interruption of their education, that they can ignore that interruption and continue to pay the benefits to you. So it's really important that if your child is out of education temporarily but intends to return to full-time non-advanced education, that you get advice about ensuring that those payments continue. If you contact HMRC about your child's situation, make explicit to them the fact that you want them to consider your child having a continuing entitlement under these temporary interruption rules. Unfortunately, HMRC are not very good at picking up on this. They, of their own volition, they often don't ask whether a child's out of education temporarily. They just assume they've left education altogether. Where there is a temporary interruption, the law says if it's due to reasons other than disability, the interruption can only be ignored for a maximum of 6 months. But actually, where it's for where the interruption's caused or linked to a disability or illness, there's no time limit. The interruption can be ignored for as long as is reasonable in the circumstances. And one of the other things to point out is the test is about whether your child's got a temporary interruption in their education, not just a temporary interruption in attendance at a specific course. So even if your child is left one course and intends, when they're better, to return to a different course, you can still argue that that's a temporary interruption in their education, at least for child benefit and child tax credit. The rules are much more restrictive if you're claiming universal credit for a dependent child. Now, I'd said earlier that this whole issue about full-time non-advanced education is really important, because if you want to continue claiming for a dependent child, at the age of 17, 18, 19, you need to be clear that your child is attending this type of education. So how do you know whether they're in full-time non-advanced education? Well, the good news is it's all defined. So full-time means over 12 hours a week. Non-advanced is about the type of course they're on. As long as it's below the SVQ level 4, then it's non-advanced. So that includes National 4, National 5 certificates. It includes hires, advanced hires. It will include vocational courses that are below SVQ level 4. If your child's on a course where there's no qualification, like a life skills course, that too would be non-advanced. However, if your child moves on to university, or if they're doing a diploma course or SVQ level 4, then I'm afraid they're in advanced education and you can't get child benefit and other payments for them anymore. The activities that your child's doing must be classed as education, and normally it must be provided at a school, college, or other approved provider. However, it can include certain types of approved training. In Scotland, approved training is training that's done under something called the Employability Fund. It can also include education provided elsewhere, as long as it's approved by the Department of Work and Pensions. So, with home education, interestingly, the practice of the DWP used to be that they wouldn't approve home education if it first started after the age of 16. But that policy was challenged via the courts, and actually the DWP lost that case. So now they do have to consider approving home education, even if it first starts after the age of 16, so long as you can show that the home education is required because of your child's disability or special education needs. So just to recap then, when are you likely to have to give up payments for a 16 to 19-year-old child? Well, first of all, if they've passed the September after their 16th birthday and they leave or cease full-time non-advanced education, then those benefits are going to stop. So that could be because they've left education altogether. It could be because they've moved from non-advanced to advanced education, or it could be because they've went from attending a course full-time to part-time. Even if your child stays on in full-time non-advanced education, there will come a point where you simply run out of road, where they reach an age where they're too old to be treated as a dependent child anymore. For child tax credit and child benefit, that point is reached when they turn 20. For other benefits, well, for universal credit in particular, it happens a bit earlier. It happens when your child reaches the September after their 19th birthday. And just to reiterate this point I've been making all along, even if your child stays on in education, if they start to receive universal credit in their own right at any point, then immediately you will stop getting benefits for them as a dependent child. So what sort of benefits are we talking about you potentially losing if your son or daughter claims universal credit? Well, we're not talking about PIP or DLA that continues regardless of whether your son or daughter is claiming in their own right. But certainly child benefit and child tax credit payments for them will stop. If they're your only dependent child, you may also lose working tax credit. Depending on your circumstances, the amount of housing benefit or council tax benefit or council tax reduction that you get could come down. If you're an old style income support claim where you get child payments, that will reduce. If you're a family who are claiming universal credit and you get child payments for that child, those payments will stop. If you're an out of work family, there's also an issue that you might end up falling foul of the household benefit cap, which is a rule that caps the total amount of benefit you can receive. So one of the exempt categories for the household benefit cap is if you have a dependent child who's in receipt of DLA or PIP. But if your child claims in their own right, they're no longer a dependent, so then potentially you lose that protection. Some people can be protected for other reasons. If they get carers allowance, someone in the household's getting carers allowance, they might still retain their protection, but there is a risk that some families could be left worse off. I just want to say something very quickly about 19-year-olds. The situation is slightly more complicated if your child's 19. So I've said already, between the ages of 16 and 19, you can continue to receive child benefit tax credits if your son and daughter's in full-time non-advanced education. Well, where your child's 19, it's slightly more tricky, because what the rules actually say is that to claim for a 19-year-old, they must either be on a course that they started before they turned 19, or they were accepted or enrolled onto before their 19th birthday. So you could have a situation in principle where a child is age 19, finishes one course, and then starts a new course after their 19th birthday that they hadn't been accepted or enrolled onto before. And technically, what should happen there is that the child benefit and tax credits would stop when the original course finished. However, in practice, HMRC often have more generous rules. What they often do is treat the new course as being a continuation or an extension of the previous course. And as long as there's a gap of no more than the school holidays between one course finishing and the other starting, it's not uncommon to see HMR treat that as one continuation of one single course that started before the age of 19. And therefore, we do see lots of 19-year-olds, their parents continue to get child benefit and child tax credit, even if they start a new course. If you run into any problems around that, then just come back to the contact helpline. We can provide more detailed advice if you've got an issue around getting benefits for someone who starts a new course after their 19th birthday. So again, I'm just going to look and see if we've had any questions about any of the content so far, if you just bear with me for a second. Okay, we don't seem to have any questions from any participants yet, so I'm going to move on now to looking at universal credit. Before I touch on universal credit, though, I'm just going to say a few words about another benefit, okay, about something called employment and support allowance, because we get lots and lots of calls to our helpline from parents who are asking, can they claim employment and support allowance for their son or daughter, or how do they go about claiming employment and support allowance for their son and daughter? And once upon a time, 3 or 4 years ago, it was very common for young disabled people to get employment and support allowance. But these days, it's really unusual, and it's highly unlikely that your son or daughter can claim this benefit. Now, there are two types of employment and support allowance. There's something that's called new style employment and support allowance, and that is a contributory benefit. And what that means is, before someone can be paid new style ESA, they need to show that they have worked and paid national insurance contributions. And they need to show that they've done that over a period of time, usually about 2 years. So it's really unusual to see a young person under the age of 20 who's actually worked and paid sufficient national insurance to qualify for that benefit. Now, the other type of employment and support allowance is something called income-related employment and support allowance. And that's a means-tested benefit for people who are not fit to work. And large numbers of young people used to claim income-related ESA. But that benefit has been replaced for most people by universal credit. The only people who are still able to make a new claim for income-related ESA are those who are already getting another means-tested benefit like housing benefit, and where that other benefit includes a payment called the severe disability premium. To cut a long story short, the only groups that we've seen that fall under this test are some young people who are in supported accommodation. So I'm not going to go into the detail of it in the session because it's very complicated, but if you have a son or daughter who's in supported accommodation or likely to be moving into supported accommodation in the next few months, please contact our free helpline to discuss whether your son or daughter would have the option of claiming ESA rather than universal credit. But for everyone else, universal credit is likely to be the only option if your son or daughter wants to claim benefit in their own right. So what is universal credit? Well, it's a new means-tested benefit for people of working age, and it's replaced new claims for most of the means-tested benefits that are out there. So you can't make a new claim for income support anymore, or a new claim for child tax credit or working tax credit. You can't make new claims for income-related ESA or income-based job seekers allowance. They've all been replaced by universal credit. Once upon a time, whether you had to claim universal credit depended on your postcode, but now universal credit's been rolled out across the whole of the UK, so it doesn't matter where you live in a universal credit area. It's a means-tested benefit, but the means test applies to the young person's circumstances, not the parent. So it's your son or daughter's income and capital that's counted, and any PIP or DLA they get's ignored. Normally, someone has to be at least 18 in order to make a claim for universal credit, but there are special rules that say if you're 16 or 17, you can claim as long as you have medical certificates from your GP. Those are called fit notes. So if your GP supports you and says, yeah, you've got a limited capability for work, it is possible to lodge a claim for universal credit despite being 16 or 17. The big thing, though, that people need to understand is there are really significant barriers to successfully claiming universal credit for someone who's classed as receiving education. And in a few minutes, we're going to look at that in a lot more detail. Before we do that, though, I'm going to assume that a young person's left education or is no longer in full-time non-advanced education and is able to claim universal credit under the sort of normal rules. So normally a claim's made online via the .gov.uk website. It is possible to make a claim via a helpline instead, but that helpline is often completely inundated with calls and it can be quite difficult to get through. As part of the process, you're going to want to submit fit notes from your GP that can be uploaded onto the claim digitally. You're going to want to do that definitely if your child's 16 or 17, otherwise the claim won't be accepted. Even if your child's over the age of 18, unless you want them to be claiming the benefit as a job seeker and be forced to look for work as a condition of the claim, then you'll have to submit these medical certificates so that they're treated as someone who's claiming on the basis of their health problems. Once the claim's been accepted, you'll have an interview with a DWP staff member who's called a work coach. In normal days, this is done face-to-face at a job centre, but during the coronavirus, that would happen via the telephone. Once the claim's been processed and it's accepted, you qualify, you'll start to get paid, or your son or daughter would start to get paid universal credit at a sort of lower standard rate. If they're under 25, single, don't pay rent anywhere because they live as part of your household, initially they're not going to get more than £79 a week in universal credit. The payments are made monthly in arrears, so they're probably not going to see a payment for at least 5 or 6 weeks. Once the claim's up and running, you need to complete a questionnaire, and this questionnaire is different from the PIP questionnaire. It's something linked to a medical assessment called a work capability assessment. It's more about your child's ability to work rather than about their need for care or supervision. You may also be asked to attend a consultation with a health professional. So it's a similar process to PIP, but a different test. There's 3 possible outcomes from that assessment. 1, your child might be found fit to work, in which case they need to sign on and claim universal credit as a job seeker. 2, it might be accepted that they have a limited capability for work. In that case, the universal credit continues. It will stay at the same rate, and they might also be expected to take part in certain activities to get them more work ready. The third option is that your child is assessed as not only having a limited capability for work, but also a limited capability for work-related activity. They're assessed as being in the more severely disabled sort of category. And if your child falls into that group, then they not only continue to get universal credit without meeting any sort of requirements to do any work activities, but also they start to receive higher payments of universal credit, and the payments go up to around about, I think it's almost £160 a week in that group. Now, I say the payments start from the 4th month. It may take more than 4 months for the medical assessment to happen. So if it takes, say, 6 months for a medical assessment and your child's found to have a limited capability for work-related activity, the extra payments would then be backdated to the start of the 4th month. But really, I can't emphasize this enough. It's going to be much more complicated if your son or daughter is still in education and wants to try and claim universal credit. And the reason for that is that under universal credit, there's a general rule that says it's not possible to be paid universal credit if you're someone who's receiving education. So that's regulation 12 of the universal credit rules. And that regulation also defines what's meant by receiving education. So if you're in full-time advanced education at university, then you're caught by this rule. If you're on a course where you can get a maintenance grant or loan, you're caught by this rule. If you are a child who's between the ages of 16 and 19 and still in full-time non-advanced education, so a child where your parents could get child benefit for you, you're caught by this rule. If you're not caught by one of those three groups, there's another group that says, even if you're not in full-time education and you're not between 16 and 19 in non-advanced education, you'll still be caught by this rule if your course is incompatible with any work-related requirements attached to your universal credit claim. So if we take the situation of someone who's turning 20, for example, and they're still in non-advanced education, the child benefit and child tax credits is stopping. Well, they're not in advanced education, they're not getting a maintenance grant or a loan, and they're not between the ages of 16 and 19 and in non-advanced education. So they potentially, a 20-year-old, will potentially be able to get universal credit despite still being on a course, but only if the DWP accept that the course is not incompatible with the universal credit claim. Now, you might be able to argue that they're not incompatible for two main reasons. First of all, the work coach, the person who deals with your son or daughter's universal credit claim, they may have not placed many work-related requirements on your son or daughter. They may have said, well, look, I accept your son or daughter looks like they're very severely disabled. I don't think it's reasonable for them to be expected to do much in terms of looking for work or taking part in any activities. I'm going to switch off all of those conditions until the medical happens. And if they've agreed to do that, then if you've got little or no requirements attached to your claim, then that can't be incompatible with the course. So you should be able to qualify at age 20 in those circumstances. Even if you do have some work-related conditions attached to your claim, it might be that the course you're doing is flexible enough that the course provider will say, yeah, you can take time out and go and do these activities that the DWP want, and it's not going to cause a problem for us as a course. That's maybe more likely, particularly if your child's maybe doing a life skills course or something like that. So there might be cases where a young person who's turned 20 or past the September after their 19th birthday and in non-advanced education might be able to claim universal credit despite still being on a course. Okay, but where does that leave everyone else? So if you're in advanced education, if you're below the age of 16, if you're between 16 and 19 and in non-advanced education, you've got this problem because on the face of things, you're receiving education and precluded from being able to claim universal credit. Well, actually, there's another regulation, Regulation 14 of the Universal Credit Rules, that says that some people who are receiving education, some students, they can claim, they're exempt from Regulation 12. That includes students who have children of their own. It includes students who are without parental support, who are perhaps living apart from their family because they're estranged from them. But in terms of our interest, I mean, particularly, it also includes some disabled students. But the problem is how they've defined which disabled students are exempt, because there's two tests that your son or daughter has to meet. First of all, they have to get or be a receipt of PIP or DLA, and that's not usually an issue. But secondly, they have to have a limited capability for work. So what does that mean? Well, a limited capability for work doesn't mean that you think your child has a limited capability for work, or they think they have a limited capability for work, or even that your GP thinks that they have a limited capability for work. It's got a very specific meaning under benefit rules. And what it means is that your child is being put through a medical assessment by the Department of Work and Pensions called the Work Capability Assessment. And at the end of that assessment, the DWP have agreed that your son or daughter has a limited capability for work. So you cannot receive, if you're caught by Regulation 12 and you're a child who's receiving education, you cannot claim universal credit unless you first have had a medical assessment and proven that you've got a limited capability for work. Now you might think then, well fine, you make a claim for universal credit for your son or daughter, it's refused, and you simply ask them to organise a medical assessment. If only it was that straightforward, because what lots of parents are describing to us is this catch-22 where they're told you can't get universal credit for your son or daughter unless they're either first put through the medical assessment or they give up their course. And then when the parent asks for the medical assessment to be organised, the DWP say, well, we're not willing to do that because we're only going to organise assessments for people who are already on universal credit. I know that sounds completely crazy, but that is the reality that some parents are coming up against. Now, we believe that there is a workaround to this and a solution, because actually within the law, there is a legal right to having a medical assessment. And I apologize in advance if this slide is complicated. I'm afraid it is just the nature of the beast. It is very complicated, the rules. So basically, there are rules and legislation that says if you're someone who's not fit to work, you have a right to have a medical assessment to prove that in order to get national insurance credits to protect your pension. Because if you're someone who's not fit to work and you're not working and paying national insurance contributions, you'll have a gap in your national insurance record. And that means that when you retire, you'll be worse off because of the fact that you've been unwell. So as a form of protection for people who are not fit to work, you have a right to be assessed as someone who's unfit to work and then to receive these credits from the government to, to basically plug the gap in your national insurance record. So how's that done? Well, it's done by way of a work capability assessment, the same assessment that's used in universal credit. The slight problem is that they haven't actually got a claim form for specifically applying for credits under this piece of legislation. What they do instead is that the DWP have said if you're not entitled to New Style ESA, but you want to be assessed for credits, you make a claim for New Style ESA, even although you know you're not going to receive the benefit itself. So you're claiming New Style ESA not to get ESA, but to get to a medical and to eventually receive national insurance credits to protect your pension. And they call that a credits only claim for New Style ESA. But the important thing about this is if you get a credits only claim in, you get a medical. If the medical says that yes, your son or daughter has a limited capability for work, although that's been done for the purposes of getting a credit, the decision is then binding also on universal credit. and it means your son or daughter at that point should now meet the two tests that we set out. They get PIP or DLA, they've shown they've got a limited capability for work because they've applied for national insurance credits, and therefore they meet the two tests. So if we look at an example, Jo, who's 18 and she's still at school, she wants to claim universal credit. Her first claim would be refused because although she's on PIP, she doesn't have a limited capability for work. She would have to make a claim for new style ESA, a credits only claim. It's really important that she makes clear that she's doing that not because she wants to get the benefit itself, but just to protect her right to national insurance credits. She'd need to submit medical certificates as part of that process. After a lengthy delay, she should have a medical assessment organised. She should be found, hopefully, to have you can make a second claim. The second claim will be successful. She meets the two tests. Unfortunately, universal credit will not be backdated though. It will only be paid from the date that she's established a limited capability for work. So the longer the delay in getting a medical assessment, the more money Jo potentially misses out on. So just to highlight a few issues about this. So first of all, remember, we're not saying every child who's in education aged over the age of 16 should claim universal credit. If your son or daughter does receive universal credit, any child benefit or child tax credit that you get for them and other benefits that you get for them as a dependent will stop. So it's always a good idea to get a better off calculation to make sure that your household would end up better off. And that's a service that we provide via the contacts-free helpline. Also, I really need to highlight that it's maybe not always that easy to get a credits only claim accepted. When you phone the DWP and try and get a credits only claim sent out or a new style ESA claim form sent out, a lot of the DWP staff are not really that familiar with the idea of a credits only claim and will try and dissuade you or say, no, your son or daughter can't claim new style ESA, I'm not going to send the form out. So you will have to be very forthright with them. And if they refuse to process a credits only claim or refuse to send you a credits only claim, get in touch with Contact because we can help you to challenge those sort of decisions. The last thing I want to say about it is that these assessments can take many, many months to organize. So in fact, normally it would take at least 6 months, I would say on average. Because of the coronavirus, it's taken substantially longer for a lot of these medical assessments to happen. So if you think you're going to want to claim universal credit for your child at some point in the future, and they're likely to still be a student at that point, let's just say you think you want to claim universal credit for them when they turn 18, it would be a good idea to make the credits only claim early, to get that claim in when they're 17, so that there's enough time for this long delay before the medical's organised, so that by the time you want to claim universal credit, your child's already established, they've got a limited capability for work. So that, yeah, I mean, we'd be saying try and get those credits only claims in as at the earliest possible point, really. Okay, so that's all the content really that I had intended to cover this morning. I'm just going to review now whether we've received any questions by this point. Just bear with me a minute. Okay, so I've had a question from Helen who's asking, if I've got power of attorney, will I be accepted as an appointee by the Department of Work and Pensions? Yeah, well, actually, that's a really good point. It's probably maybe one I should have mentioned earlier. If you already have like powers to manage your child's affairs, whether it's a power of attorney or whether it's financial guardianship, then yes, you automatically will have the power to manage their benefits. Those kind of powers, those more formal powers, they actually trump the appointeeship altogether. So yeah, you shouldn't have a problem. You'll definitely have the right to manage benefits for your child in those circumstances. Okay, so just to emphasize a little bit before I pass over to my colleague Tracy just for a minute. obviously, this is a very complex area, as you've probably gathered, particularly trying to claim universal credit for your son or daughter. But there is help out there. During the lockdown, it's been difficult to get advice face-to-face because a lot of citizens' advice bureaus and other benefit projects have closed down. They are now starting to open up. Sometimes they're doing advice over the telephones rather than face-to-face. You can also access really detailed advice via contacts-free helpline, the details of which are on your screen just now. Now, in a few minutes, we're going to stop the session, but just to remind you that when the session ends, there will be a short questionnaire that will be launched. Please take the time if you can to complete it, because it's really, really helpful for us in planning other activities. And the recording of this webinar, any other questions we've not been able to answer, will all be on our website next week, so at the link that's on the screen. So I've finished everything that I was intending to say, but I'm just going to pass back over to Tracy Francis for a minute, who's going to say something quickly before she gives a final goodbye. So Tracy, if you're ready, do you just want to take over?
That's fine. Thanks, Derek. And I'd just like to say a really big thank you for all of that, because it's such a complicated area. And I know I talk to so many parents across the country, and money is one of the things that so many of us bury our heads in the sand about. And yet, if we haven't got that straight, you know, we're in danger of missing out ourselves, but we're also in danger of missing out on behalf of our young people as well. So I think the one thing that I would take from that, that I'm sure will be so for everybody else who's listened, is it's so important to get into individual assessment, individual conversations around your own personal circumstances, because every family is different and it will vary depending on the condition that your young person has, your own situation, other people in the family, other allowances that you're receiving, and so on. So, you know, do make use of Contacts Helpline, their family finance team, Citizens Advice Bureau, the other people that Derek mentioned who can help out with this as well. It's so important to get on top of it. And you don't have to do it all in one go, but just a little bit at a time. And then over a period of time, you know, you'll find yourself in a much better situation and where you need to be in relation with your young person. The only other thing that I wanted to mention was that it is also a contact website, but the website Talking About Tomorrow, which we've referred to before in webinars as part of this series, and that's got a whole section on finance. We've only looked at benefits today. We haven't looked at self-directed support. We haven't looked at some of the other, sort of help that you can get with things like blue badges, with things like reductions on council tax. There's a whole host of things that when you put together can actually be worth quite a lot of money to families and quite a lot of money to young people to help them out. And of course, when we had our webinar with LEAD, we talked a little bit about finance around education. There are some things around that too. So I think we will be revisiting this topic as a webinar, you know, sort of later on, perhaps towards the end of the year. So do watch out for information on other webinars and so on that we have planned. But otherwise, that's just to say thank you very much for coming along this morning. Derek, do you want to say anything else before you finish off the webinar there?
Not really, just I guess just to thank people very much for their time today. We know you're very busy and have lots of other demands on your time, so we really appreciate you taking time out of your busy week just to join us today. So thanks very much, everyone, and we'll be ending the webinar now. Okay, goodbye.
Thank you. Bye-bye.